Estás viendo Canal América, televisión dominicana para el mundo.
Atimefortruthshow is sponsored by the Office of Dr. Bernardfialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to Atimefortruthshow. I'm your host, Dr. Bernardfialkoff, and it's a pleasure to be back with you again today at the space where you connect with what's going on in the world, with the changes, with the positive benefits that we have in today's highly advanced technological world. And tonight, I have a very special show for you because it has to do with keeping your wellness, your energy, and also that smile. You know that I've been in periodontics and dental implantology as a specialist for 45 years. And one of the things I wanted to cover is how do you maintain that wellness, that energy level, that smile? You know, all the things that make you confident and make everything just go so much better for all of us. So we want to cover something that's extremely important that has to do with the influence of periodontal gum disease, diabetes and blood sugar problems, and heart problems, high blood pressure, cardiovascular problems, and how they actually interrelate as a triangle, one affecting the other, and what you can do to actually prevent this from occurring in your life, and so that you can live the way you always envisioned and without suffering from these maladies that are affecting so many Americans. So let's get right to the slideshow. Engineer, let's put up the slideshow, please. And we want to start out with this slide because it's very important, because you see that half of American adults suffer some form of periodontal or gum disease. It's an amazing statistic. And you know, 64 million adults 30 years of age or older suffer from periodontal disease. It's a tremendously high figure and really much, much too high. So how do you know if you have gum disease? What are the signs? What are the symptoms? Next slide, please, engineer. And here we go. These are the signs and the warning that you need to look at in terms of gum and periodontal disease. Bad breath or a bad taste that doesn't seem to go away no matter how much you brush, you floss. Your gums get red. They're swollen, puffy. There's a tenderness that occurs. And you notice bleeding. You notice you brush your teeth and you have blood on the toothbrush. Or when you rinse your mouth, you see blood as you spit out. You have discomfort when you start chewing. And you're chewing and you notice that there seems to be some looseness of a tooth that you never noticed before. Or that when you're eating or drinking something, the teeth are sensitive. And you look in the mirror because you want to see why they're sensitive, and you see that the gums have pulled away from your teeth. They've receded. And it just doesn't, you don't remember that before. It doesn't seem like your teeth are fitting together the way they used to. And when you bite, it feels different to you. And if you have different replacements in your mouth, it seems like there's been a change. You see dark triangles between the teeth. You see exposure of metal margins. And you realize something is not right. So let's go on to the next slide. And here we see the symptoms visually. The redness, the puffiness. On the upper right, what you see, that dark brown, irregular substance on that tooth, that's called tartar or calculus. These are calcium deposits that form on the roots of the teeth and on the crowns of the teeth and irritate the gums. This calculus comes from the bacteria that form in the mouth. And you see how they irritate and inflame the gums. You see how red they are, very inflamed. And very important to realize that the association I'm part of, the American Academy of Periodontology, recommends you to have an annual checkup. And also it's important that you have a cleaning at about 3-month intervals to keep this from forming. Because see, this person has let it go too far. Let's go to the next slide. So, what about periodontal disease and diabetes? How do they relate? What is this two-way street that you hear about? Well, first of all, we have to realize that diabetes affects 30 million Americans. 30 million Americans. And that on top of that, 35 to 40% of Americans have diabetes but are undiagnosed. So unbeknownst to them, their diabetes is affecting them not only in terms of systemically in their body, but also in their mouths. Because the diabetes makes your gum disease worse, and your gum disease out of control makes your diabetes worse. And it's important to realize that more than 60 million Americans in the U.S. are currently at risk for developing diabetes. And, you know, it's important that we somehow prevent this. So let's go on to the next slide, please, engineer. This periodontal disease is an infectious process. It's an inflammation. And this inflammation in the periodontal structures causes bleeding, redness, inflammation, and it changes different mediators that affect not only the periodontal disease, but get into your bloodstream. And these mediators affect inflammation in your body and affects your diabetes. Also, the bacteria that are in your mouth, that are in these inflamed tissues, enter the bloodstream, causing changes within your blood vessels, within your veins. And so it's important to treat this because by removing these bacteria, what we call plaque, these germs, and the tartar and the calculus, we improve the inflammation and we have a positive effect on the diabetes. Let's go on to the next slide. And here is something very important to keep in mind. Inflammation is the common denominator of all diseases. So when we're looking at this slide, we're looking at heart disease at the top. We're looking at Alzheimer's and dementia. We're looking at rheumatoid arthritis. We're looking at periodontal gum disease. We could be looking at diabetes. We could be looking at, skin problems. All of these have the common denominator of inflammation. And so we want to minimize inflammation, because otherwise what ends up happening, we start developing disease. And the inflammation leads to these different diseases. So obviously then, what we're looking at is, what do we do to minimize inflammation? Let's go on to the next slide. So let's first of all take a look at diabetes. And take a look, the diabetes affects heart disease. So we have 2 to 3 times more heart disease because of diabetes. And diabetes causes more gum disease. And the gum disease becoming out of control worsens the diabetes, which obviously leads to the heart disease. And that 280,000 heart attacks occur annually. And this in diabetic patients. And so 60% die from these heart diseases and different maladies, what we call cardiovascular disease, exacerbated by the diabetes. And it's very important to realize, because we want to prevent this. So let's go on to the next slide. One of the things that you can do, and that you should be doing if you have a blood sugar problem, is you should definitely get an A1C test. An A1C measures your control. How well controlled or how out of control is your blood sugar? And for the A1C test, below 5.7 is normal. Some of you are probably, as you're watching this video, are saying, oh my God, I'm much higher than 5.7. Well, the first step in fixing something is to realize it and to confront it, because you have to realize that 5.7 to 6.4 is what's called prediabetes. It's a stage that's going to be leading you into full-blown diabetes. And over 6.5, now you have type 2 diabetes. And it's now something that's going to need, more than likely, if it can't be controlled by diet, to be medicated. So obviously we want to prevent this. So we want to prevent the inflammation, and we want to prevent what's getting you there. How do we do that? Well, very important. We have good vitamins, vitamin C, vitamin E. We have the orange and yellow vegetables and fruits, which are called beta carotene, which are very good for you. If you consume a balanced, nutritious, fiber-rich diet with fruits, with vegetables in adequate amounts, having less meat, less poultry, but having more fish, maybe having eggs, maybe substituting some nuts. Walnuts are very good. Pecans, almonds. And sometimes when you just can't get fish, you can take 2 or 3 omega-3 fish oil tablets or capsules, which help you to get those good fats that you need. So next image, next slide, engineer. So, how does this happen in the mouth? Well, what happens in the mouth is first you develop something called a biofilm. And this biofilm, which is a soft, sticky, invisible layer of germs, which we call bacteria or plaque, mixes with the proteins in the saliva and the other debris, and it forms a film on your teeth, which is why we stress brushing twice a day and flossing at nighttime to remove this biofilm. What happens if you don't remove that biofilm? then you start developing plaque, which is a more hardened form, starts adhering to the teeth, and begins 12 to 24 hours, and can lead to a more visible yellowish white hardened deposit on the teeth. That's now plaque. Now we've gone from biofilm to plaque. And if you leave that plaque and you don't remove it, then it enters the calculus or tartar stage, where the minerals in the saliva mineralize the plaque and harden it into calculus or tartar, which is like mixing the cement with the water, making the mortar. And so now you have a hard deposit that many times turns brown, gray, black, and serves as a really good hiding place for more bacteria. And you get more inflammation. And as you get more inflammation, you start getting bleeding. The bacteria start entering your bloodstream. And different mediators called cytokines, they're mediators that cause inflammation. Remember, we spoke about how inflammation is what's causing all diseases. So now your periodontal disease is causing inflammation within your blood vessels. And it's affecting not only your heart, but it's affecting your blood sugar. Because as we get inflammation, we start getting out of a normal physiologic or out of a normal range into a more abnormal range. And now we have more and more of this inflammation occurring. So let's go on to the next slide. And here you see what we need to do very simply. You need to brush at least twice a day. You don't need to use a tremendous amount of toothpaste because toothpaste has a lot of abrasive in it, which can abrade your gums. So you just need a little bit, like a pea size of the toothpaste. And you need to brush twice a day. Flossing, I recommend to floss at nighttime. You can get the wax, the unwaxed. It doesn't really make a difference. The most important thing is to floss. I'd recommend to floss first and then to brush afterwards. And what I want to show you on that top image is the teeth on the left, normal, without biofilm. But what happens as you go to the right, how you start developing that biofilm. And that biofilm starts turning color and starts to harden. And then if you look at the next slide below, you'll see that in that image, you have a lot of tartar. And that tartar is what accumulates. So how do you eliminate this? You eliminate your sugary foods, because sugary foods give a lot of energy to the bacteria, and they grow, and they proliferate on your teeth and gums, causing more and more inflammation. So we don't want to have sugary foods or drinks. We want to have a nutritious diet, as we mentioned, with the fruits, with the vegetables. Some organic high-density chocolate is great too, in moderation. And it's very tasty. And the other thing very important is to make sure that your dentist is seeing you at about a 3-month interval. Your insurance may cover twice a year, 6 months, but I would recommend for you not to wait the 6 months, but to actually go much sooner. So now let's go here and let's take a look at this slide, and let's take a look at some things that you can control or eliminate. One is smoking. So smoking, you want to eliminate. Smoking is something that increases your risk of gum disease and diabetes and heart disease. So if you smoke and the same you was standing or sitting next to you and wasn't smoking, the you that doesn't smoke does 2 to 3 times better with any treatment and with any chance of avoiding disease. 2 to 3 times. Unbelievable amount that you can do just with the smoking. The other thing I wanted to mention, not just smoking cigarettes, But smoking marijuana actually is even more harmful because the marijuana has different ingredients and different toxicities included in it, which actually harm the gum even more so than the smoking. Some people say, well, I don't smoke, I don't do that, I vape. Well, vaping is actually even more harmful because these toxic fumes from the actual flavorings only affect your gums. And they make your gums dry, very irritated and inflamed. So routine smoking, marijuana smoking, and vaping, even just flavorings, is very harmful to your gums. And what you have to realize is if it's harmful to your gums and in your mouth, you have to ask yourself, what is this doing in your lungs, in your bloodstream? And the answer is scientifically causing tremendous amount of harm. In fact, many young people have developed something called popcorn lung, where they've even died in intensive care units from smoking from the vapes, from the fumes of the vapes, just from the flavorings. Another risk factor for the periodontal disease, obviously, is the diabetes, which is important to control. Your hygiene, which we went over. Another factor is stress. Why stress? Well, the Surgeon General recently came out with an advisory, what he called an advisory. And the Surgeon General's advisory, he mentioned for us to have good social contacts, to have good relations, because having that good social relationship with your family, with your friends, with others, actually makes you healthier. He found that scientifically, a good social relationship led to increased health, better emotions, better mental state. But I think the thing I want to stress in this program is better physical health. Mental, emotional, we realized always that stress affected that. But physical health is something very important. He even said that having a lack of these relationships actually increase your morbidity or your likelihood to die 10 to 15 years earlier, which is amazing to me. Another factor which you want to control your gum disease is if you have a lot of crowding. If your teeth are crooked, you probably should take a look at straightening them. The new technology is called Invisalign, which are invisible, clear braces, plastic without wires, that can do that for you. Sometimes there are fillings that have become defective. It's important for you to see your dentist to fix your fillings so you don't have holes in your teeth where these bacteria can proliferate like in caves and cause gum problems. Sometimes you may be on different medications. So if unfortunately you've already developed high blood pressure, you have to realize that your medications may dry your mouth. Sometimes you may have been put on a relaxant or an anti-anxiety drug. You have to realize that these drugs actually affect your bone health because they affect your bone healing. And they also affect the dryness in your mouth. And so these anti-anxiety drugs related to the stress actually cause increased harm and increased likelihood that you won't heal as well from any kind of procedure that we would do for you as a dentist. If you have bridges that don't fit properly, get those repaired. Don't let them go on because then you can fracture teeth, lose more teeth, develop more inflammation, more bite problems, which obviously would lead you to have more stress and more likelihood to run into these other maladies. With our women in our viewers, you all know that when you have your menstrual time of the month, the hormones go higher. During that time, you have to be really cautious to make sure you perform good hygiene, to really stay on top of it. Because unfortunately, for our women, with this hormonal changes, and especially with pregnancies, you can definitely develop periodontal problems, recessions, bleeding, and other maladies in the mouth that can be controlled. Make sure that when you're pregnant, see your dentist more frequently. So let's go on to the next image, please. And in this image, what we want to go over is that it's very important that you be screened, that your blood pressure be taken, that you monitor your blood glucose. Don't get overweight, and if you do, consider a diet. If you have a family history of heart and diabetes disease, control your sugar. See your physician, see your dentist. Control your inflammation. If you have sleep apnea, correct it, because lack of oxygenation when you sleep causes inflammation in the body, causes other diseases. And so it's very important to control. In our offices, we have different tools that we apply, sometimes salivary tests, glucose testing. We examine you, we take x-rays to measure your inflammation. We update your medical history. And it's important that we get on top of this and don't let it get out of control. Next slide, engineer. So I hope this has helped you. I hope that you found this useful to you and that you can start controlling the way you feel, the energy level that you have, and get an increased energy, that your smile can return. With your dentist, as a periodontal implant surgeon, so much is possible nowadays to get your smile back. With implants, with the Invisalign, realignment of the teeth, with your orthodontist. And more importantly, we collaborate with your physician, with your medical doctor, with your nutritionist, and get you on the right path to controlling your diabetes, controlling your heart disease. Avoid those high-fat diets. Avoid the potato chips. They taste great, but they harm so much. Avoid fried foods, processed foods. Stick with avocados. Stick with the nuts. Stick with the fruits and the vegetables and the salads. And as you go on, you'll be glad that you did. Get some exercise. Go for walks. Decrease your stress. Hang out with people who love you, with people you get along with. Avoid negative environments. And yes, it is possible. Form new habits. You know, habits form over a lifetime. But when you look at what we showed you on this show, and we realize the consequences of what happens with diabetes, with heart disease, and we really look at how we want to live, let's choose to make those habits become a reality. I hope it's helped you. I hope you can apply this, and we'll have more episodes in the future. But for now, from Atimefortruth show, it's been a pleasure being with you, and we bid you a good night.
This show was sponsored by Atimefortruthfoundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet